Hello, and welcome to another episode of Heart to Heart. I'm Dr. Jeff Gold, and I have the honor of serving as the president of the University of Nebraska. And I am truly delighted to host this podcast series. Heart to Heart is a series where we connect with leaders across Nebraska and well beyond who are making a difference in people's lives. And today is a great example of that. I'm joined by my friend and colleague, Dr. Dele Davies. Dr. Davies currently serves as the Interim Chancellor of the University of Nebraska Medical Center. It's so great to have you with us today, Dele, and to introduce you to our audience. Our audience is always interested in a little bit about your history and your roots. Where did you grow up? What did you study? And most importantly, how did you make Nebraska your home?
Well, first of all, President Gold, thank you for the honor of joining you on this podcast. As you know, I've been in Nebraska for just over 13 years. I had no prior knowledge of Nebraska prior to coming here. I was invited by a search firm led by a former colleague and dean of mine who took on the job of a senior vice president of the search firm. And he told me about this job and asked me to look at the position of vice chancellor. So when I first came to Nebraska, what struck me was a sense of purpose that runs through the state. I saw a community, a state where people care deeply about their communities. I saw a state where there was a very generous and impactful philanthropic community. And I saw a state where people truly care about doing what's right and making sure that their work was meaningful. And those were values that resonated deeply with me. And of course, coming to UNMC, I saw UNMC being right at the heart of that purpose, an institution that serves and trains the next generation of healthcare professionals, supports hospitals and clinics across the state, and drives innovation that benefits families while impacting the world right here in Nebraska. So, as a pediatrician with a background in infectious diseases, I just found a lot in common with this university and Omaha in particular. I could see a place where my family and my children could grow up and call home. And now it is their home, it is our home. Having grown up in Nigeria till I was 15 and living in England, and living in Canada for many years and at Michigan State as chair prior to coming here, I really can say that I found home right here in Omaha.
And we're so very glad you did. So let's talk a little bit about recruiting and retaining students. As you and I both know, UNMC is the largest producer of healthcare workforce for the state, and not just, of course, in the Omaha area, but literally in every one of the 93 counties of the state. Through our education programs, through our residency and fellowship programs, and now with the soon-to-be opening of the second phase of the Health Science Education Complex in Kearney, how do you see us supporting the rural growth of workforce, which is so critical?
Well, thank you. As you know, as you've identified, Nebraska has an acute shortage of healthcare professionals, and UNMC is leading the state in making sure that we overcome that challenge. 56% of all the healthcare professionals in the state of Nebraska were trained at UNMC. And we do that by going across the state, listening to the communities, trying to understand what their needs are, and making sure that we help overcome the barrier of any student, any potential student who wants to become a healthcare provider within the state of Nebraska, and making sure that we remove every barrier from anybody becoming one. And so, how do we do that? We do that by listening, by partnering, by working with our communities to identify their needs. We have pipeline programs that we've instituted over the years where we allow our students to basically become our students before they show up at UNMC. So we have programs, for example, that we take students right out of high school and they're admitted to UNMC while they attend state schools like Wayne State, Peru State, or and other universities like UNK, and they then basically are accepted to those schools, and they become UNMC students on day one. At those undergraduate students, they come to us and they learn from us while they are still in their undergraduate schools, and then they get a very soft landing when they come to us. We also remove barriers by having affiliation agreements with high schools, where, for example, school students who are doing dual credits in high school and have maybe get an associate's degree before they finish high school, or maybe they don't even have associate degrees, but they've completed a lot of the courses, can then be admitted directly to our nursing school. Scholarships are important, President Gold. As you know, financial burden is a huge problem, and that's one of the major foci of our current capital campaign to try and get as much scholarships to support our students. Well, you mentioned the Kearney campus. Um, we have an opportunity through this expansion to more than double the number of students we're training on that campus from 300 to over 600 students will be trained in the largest academic healthcare complex in any part of rural United States. And that's going to allow us to also, for the very first time, train medical students. And so, we have a great example of students who already are there, who are training on the current campus. 85% of students who train right now in nursing or physical therapy, occupational therapy stay in rural Nebraska. So we really think this is going to be a big game changer for rural Nebraska. And again, just working closely with the students there to not only are they going to be in Kearney, but when they finish the first phase of their training, they're going to need to rotate throughout the state of Nebraska because we're not going to have enough clinical rotations in Kearney. So this is an opportunity for Scottsbluff, Chadron, every single community in Nebraska is going to benefit by having this expansion.
Well, all of that is really exciting, and as is always the case for the University of Nebraska, the way we understand and meet the need of our state, and we provide the critically important educational services, support services, outreach, etc. So let's shift gears for just a couple of minutes and talk about research and scientific discovery, and of course, commercialization of that research into products and services that really help improve health, not just across our state, but around the world. How do you see the future of that shaping out, particularly given some of the challenges that have been going on in research funding across the country?
So, President Gold, I'm glad you brought that because people may not realize that, we spend over $280 million every year on research. And every $1 million, is 15 to 30 jobs that are created right here in the state of Nebraska. And more importantly, most of that money comes from outside the state. So this is new money that's being infused into Nebraska every single year. We lead the world in areas including cancer, neuroscience, pharmacology, infectious diseases, health security, and we've built networks across the state. So we're not just doing this work in Omaha. We have partners across the state in primary care clinics in Kearney and across the state that we work together to make sure that these discoveries are benefiting the state of Nebraska. So, this is why it's critical to continue the great work that you and others have been doing in advocating that the federal government continues to fund the research that is helping and leading to life-saving cures. You probably, well, you know very well that even as recently as the last couple of months, we've had breakthroughs right here in Nebraska that are changing the world. So we've had a couple of patients who, for the first time in the history of medicine, refused a specific treatment for lupus and one for multiple sclerosis that was translated from our knowledge of the work that's being done in cancer. So Dr. Matt Lonning, working with colleagues here like Dr. Reina Zabad in neurology, treated the very first patient to get allogeneic CAR T therapy
Mm-hmm.
that really is changing the life of a patient and now part of a clinical trial where Nebraska was the first to do this. And these are people who would not have access to this treatment if it was not for the research that was being done here in Nebraska. So, it's important that the federal government continues to fund life-saving cures that occurs in academic health centers like ours. And we're very proud at UNMC that we have world-class researchers who are really leading and helping to transform lives in Nebraska and across the country.
Well, certainly on behalf of the entire university, Dele, and from behind the entire state of Nebraska, we're so grateful to you, and we're particularly grateful for everything that UNMC and our clinical partners do every day. In many ways, having been in academic healthcare almost my entire career, I'm well aware of the importance of what large and successful academic medical centers do for their community. They educate the workforce, they do cutting-edge research, they, of course, provide world-class clinical care, but they uplift the economy as well through high-paying, stable jobs. And all of that goes together into the leadership that you bring to UNMC. So I thank you for joining us today on this podcast. I thank you for all that you do. And to our audience, thank you for listening to this podcast. And until next time, I'm Dr. Jeff Gold.